So this is the second video in our series about fibroids, and in this video we're going to focus mainly on what fibroids do to fertility. As I said previously in my other video, because I'm primarily a fertility physician and reproductive surgeon, this is what I see, and I acknowledge that fibroids cause all sorts of other problems potentially. But for me, because this is what I see most commonly, this is what I just want to talk about in this video. Now, what they do to fertility really depends on the location of the fibroids. Fibroids are classified by their locations, and there are two types of classifications. So one is more complicated. This is based on the International Federation of Gynecologists and Obstetricians, and they essentially classify fibroid based on locations into 9 different groups, like from 0 to 8. So that's probably too complicated for our purposes. So if we use a slightly more simplified classification, and that is, fibroids exist in 3 locations, mainly. Fibroids either exist on the surface of the uterus, poking out. They exist inside the uterus, but embedded in the muscular layer of the uterus, which is the main proportion of the uterus. Or they grow inside the uterus and they poke into the lining of the uterus or into the uterine cavity, into the inside of the uterus. The ones that stay on the surface of the uterus, these are called subserosal fibroids. These really don't cause a fertility issue. They don't really cause any other issues either. They sort of cause issues when they grow too big and they press on organs. They get these pressure symptoms that we talked about previously. But from a fertility perspective, there's no effect, we don't think. Fibroids that lie embedded in the middle of the uterus, in the muscular layer, these are called intramural fibroids. And these, we think, do cause some fertility effects. So when you look at the studies, intramural fibroids are linked to infertility. They are linked potentially to implantation, and the data regarding miscarriage is a little bit ambivalent. What we don't see conclusive evidence of, there is some but not conclusive, is that we don't see enough evidence that if you remove these fibroids surgically, that it leads to an improvement in fertility. Finally, the ones that grow inside the uterus, that poke into the cavity, into the lining itself, these are called submucosal fibroids. And there's studies that suggest these are linked with infertility, potentially even miscarriage, and removing them may have some benefit. So how do fibroids cause fertility issues or even implantation and miscarriage issues? I think the mechanisms are complex, but they fall into a few broad general categories. First of all, they can cause anatomical distortion into the cavity. If you have a big fibroid poking into a cavity, it's going to distort it completely, and that change in anatomy may be enough for an embryo to not implant into the right place. By changing the anatomy of the cavity and into the anatomy of the fibroid itself, it can change the way the uterus contracts. Contraction of uterus at timed contractions, coordinated contractions, is really quite important for making sure the sperm goes into the right direction after intercourse. So if that's aberrant, if that's off, then really fertilization and therefore fertility and conception is affected. We also think that some of these fibroids have quite a thick outer shell or a capsule. And these capsules, when thick enough, can disturb the nerve endings in the muscle of the uterus. And by disruption of these nerve endings, again, coordination of these contractions is disturbed. Fibroids can also change fibroids that poke into the lining and are big enough in the muscle that they also begin, even though they originate from in the middle of the muscle and they can poke into the lining when they get big enough, these fibroids can also change the blood flow to the cells that line the cavity, so the lining cells that are crucial to accepting an embryo. So when you change their blood flow and change the distribution of blood supply, then implantation can be affected. They also potentially cause an inflammatory effect. And really, inflammation is helpful in the body when you're fighting disease and so forth. But from a fertility perspective, inflammation is quite bad. And we know that if you have aberrant inflammation caused by fibroids in the lining, then all the chemicals, all the mediators that are essentially changing the lining to make it an acceptable environment for the embryo to stick and implant, all of these factors are essentially turned off or disrupted by this inflammatory effect. And we know that certain genes that are associated with implantation are less likely to be expressed when there's a fibroid poking into the cavity. So these kind of effects that we see, changes in contractility, changes in anatomy, changes in blood flow, inflammation, and leading to a change in the molecules that normally exist inside the lining to facilitate implantation, all of these are affected, and they can lead to fertility issues and potentially even miscarriage issues.